It's very hard for us as healthcare providers to say to a patient, well, you can't drive anymore because you have early Alzheimer's disease. It's not necessarily true that just because you have early Alzheimer's disease that you shouldn't drive. In some individuals, the ability to drive may be preserved for a few months or a couple of years before other symptoms begin to affect driving. And it's very hard to make an arbitrary decision and say you shouldn't be driving. And so what we do in our clinical practice is to recommend that the individual undergo a formal driving evaluation. The typical test that's done by most registries of motor vehicles when you go to renew your license really doesn't get at the issues that affect individuals with Alzheimer's disease. You typically get a test of your eyesight, which in most people who have Alzheimer's disease is not affected. Really, it's the perception and not the sight itself. There are driving evaluation programs around the country that are typically offered by rehabilitation facilities. A lot of times these are geared towards individuals who've had a stroke and may have motor problems when they're driving as opposed to cognitive problems. But more and more of these programs are understanding that cognitive deficits can have an impact on driving to as great an extent as motor deficits, and begin to pay attention to those things. The evaluation will consist of questions about traffic rules, may consist of a brief series of tests of reaction time, how quickly you can respond to changing lights, for example, and then an actual drive in the car, taking somebody out on the road and having them do a series of maneuvers to actually see how do they perform in such a situation.